Te Whakatohia. So
among local Māori. She took a hardline approach, scolding patients who refused to accept new styles of medical treatment, and the community turned on her and refused to listen, although that technique can sometimes work.
But Ākinihi Hei learned a lesson from this. She wrote in her journal that
great discretion must be used not to offend the patient's beliefs, and at the same time uphold one's own mission.
Later, when Ākinihi was treating another outbreak in Hiruharama, Jerusalem, on the banks of the Whanganui River, she changed tactics, encouraging the community to work with her rather than ordering people around. And it worked. Whānau worked with her to dig drains, move homes to higher ground, and isolate sick people.
And around 1890, thanks to a combination of increasing immunity, improved sanitation and better access to food, the national Māori population started recovering.
But outbreaks of infectious disease still killed a lot of people. Ākinihi Hei was one. She died from a typhoid infection while treating an outbreak of the disease among her family in Gisborne in 1910. She was just 32 years old.
Pākehā authorities often praised people like Ākinihi Hei and Te Rangihiroa, but they didn't treat Māori healthcare as a priority. Efforts to create independent Māori health councils collapsed. There was limited funding to improve infrastructure in Māori communities or to train Māori nurses and doctors.
The first systematic tuberculosis survey among Māori was in 1933 in Waiaku on the east coast. 1 in every 20 Māori had the disease, and the death rate was 10 times higher than for non-Māori.
And Māori weren't the only ones to suffer unequal burdens from disease. Chinese, Indian and other non-British migrants were often unfairly stigmatised as carriers of infectious disease, sometimes with tragic results.
In 1903, Kim Lee, a Chinese fruit seller in Wellington, was suspected of having leprosy. He was quarantined alone in a cave on Mokopuna Island in the middle of Whanganui-a-Tara, Wellington Harbour. Food was delivered by a rowboat or a flying fox from nearby Matsu, Soames Island.
It's now thought Kim Lee probably didn't have leprosy at all. It was most likely a more common disease like tuberculosis.
OMG.
He spent 6 months alone on Mokopuna Island before he died there of heart, liver and kidney failure.
OMG, it's a last chance to pine.
New Zealand's most deadly pandemic was the 1918 influenza pandemic, commonly called Spanish flu.
It probably started on a pig farm in the United States, then made its way into the trenches of Europe in the final year of the First World War.
The only reason it's called Spanish flu is because Spain is the first place where its outbreak wasn't suppressed by wartime censors. It's rapidly spread around the rest of the world as soldiers returned home, and is estimated to have killed at least 50 million people. That's double the death toll of the First World War itself.
Communications.
People sometimes compare the 1918 pandemic to COVID-19,
Bye.
but there were some big differences.
It's
The 1918 pandemic mostly killed young, healthy people, and its deadliest wave spread across the world in a matter of months.
82 extra beans, bruh.
In Aotearoa, some efforts were made at local lockdowns. But those lockdowns weren't strict enough to prevent the virus spreading, and they weren't centrally organised, so each region came up with their own rules.
What's worse, many communities organised public celebrations marking the end of the First World War. Those celebrations turned into super spreader events.
There was no paid sick leave in 1918, so many people either risked catching the disease at work or being hungry, like 19-year-old Janet Fenton, who lived in Mount Eden.
He's the imposter.
Janet got some shifts at the ammunition works, but she also had to steal from the greengrocer to feed herself and the family she was living with. She wrote,
One by one, all of us came down with the flu. I was the last. I was sitting on the front porch waiting for the doctor to come. Next thing I knew, he was carrying me to bed. "It's your turn now," he said. "Well," I said, "who's going to steal for us now?" We were skin and bone when it was over.
In
Yeah.
many places, communities banded together. Food was delivered to the houses of sick people by volunteers, including children and the Boy Scouts and church groups.
Doctors and nurses caught the disease themselves, and ordinary people had to fill their
Slide
place.
down this
Gerda Scott
ladder.
started off washing dishes at Masterton Hospital. 3 days later, she was second in command of nursing. She wrote,
We did our best, goodness knows, but we knew so little. I think the worst ordeal was when some husband or wife would ask me to find out about his or her spouse, and I'd lie when I knew he or she had died.
Outside the Pākehā-dominated towns and cities, Kāinga Māori were hit even harder. The 1918 flu killed 49 out of every 1,000 Māori, compared to just 6.5 out of every 1,000 Pākehā.
Pākehā volunteers often organised relief missions to their Māori neighbours.
Yeah!
Remote Kāinga had no outside support.
In some small communities, everyone got sick. No one was healthy enough to feed and care for the most vulnerable. The famous Te Raroa activist
Ryan
David
can
Mackay
get
lived in
now.
Pangaru on the Hokianga Harbour. She was pregnant
The
when
jungle.
birth. She later said this about the experience.
I was the only one that came through out of all the ones
Greenhouse!
that were pregnant. They all
Warmer the
died. And also the babies. They died. Everyone was sick. No one to help. They were dying, one after the other.
Now, tell me, God,
Father was
Jack.
very, very sick then. He was the
Fair.
first one to
Now,
die.
to the laboratory.
I couldn't do anything for him. There was a feeling that
Banana just killed me.
nothing. Your feeling for your relative, it wasn't there. Like my own father. When I knew he was dead, I don't think I even cried.
Said my heartbreaking pet Snowball.
Whina Cooper, just like many others, was in shock. Nationwide, at least 9,000 people had died in just 2 months.
But New Zealand's worst legacy from the 1918 pandemic was in Samoa.
And
New Zealand soldiers
chill.
captured Western Samoa from Germany early in the First
Tell
World
was
War. Military administrators failed to maintain
the
a quarantine,
imposter from-
then doubled down on that failure by failing to support sick Samoans.
last hide and seek game that we
It's
had.
estimated 8,500 people died. More than 20% of the entire Samoan population at the time.
6,
Many of them are buried in a mass grave right in the centre of Aotearoa.
2,
We'll talk more about this incident in another episode of the Aotearoa History Show.
Woohoo! We've won it
One thing
again!
did come out of the
$1
1980s,
billion, baby!
a major review of New Zealand's healthcare system.
There was heavy
162 extra beans,
One
man!
David Lloyd
100 beans, baby!
Overseas described the health department
I'm
as
at
helpless and
Level
wholly unprepared.
51.
Clay and other critics focused on the failure of quarantines, which could have stopped the disease reaching Aotearoa in the first place, or at least preventing it from spreading so quickly.
Anyways,
In response, the health system was completely overhauled.